With World Heart Day on September 29th, do you know enough to keep your ticker operating in tip-top shape? Well, here is Dr. Brian Bethea with Tenet Florida Physician Services. Dr. Bethea, welcome to the show. How you doing?
Thank you. It's good to be here.
All right, so World Heart Day is September 29th, right? Tell me what, obviously, what do you want to take away? What do you want people to take away from World Heart Day?
The most important thing when you're dealing with heart disease or any other ailments is really preventative medicine and catching something early where your physicians can still have time to work with you. It makes it really hard on us in our world if we don't find you until after the late stages of a disease process.
So, all right, let's talk about that then as you're leading up to before people come visit you. What are some things people can watch out for at home?
Well, some things would be, symptoms of chest pain, shortness of breath, dizziness, passing out, feeling like your heart is fluttering out of your chest. And that kind of brings us to our next important point, right? We have a free health screening at Florida Medical Center on September 29th. And who doesn't like free stuff?
Who doesn't like free stuff?
I mean, come on.
Everybody likes free stuff.
Everybody likes free stuff.
So if someone is watching and they're thinking, well, I don't need a free heart screening, I'm in good shape, I'm healthy, I would imagine, you hear about athletes sometimes that die of heart disease, that they seem perfectly healthy as well, right? So even though I'm guessing someone may seem overtly healthy, they may not be heart healthy, right?
That's exactly right. There are certain conditions that present with symptoms, which makes it very easy to pick up with, but then there's a certain percentage of ailments that present without ever presenting with symptoms. So it's important to be seen by a physician.
Okay, so this screening on September 29th, tell me more about it.
Well, they'll come in and they'll get their vital signs taken, they'll get their heart and lungs listened to, and they'll get some blood work done to try to see if we can't pick out some early warning signs that they may actually have a problem.
And what can people do at home to try and make sure they don't end up with heart disease? I mean, obviously watch what you eat and exercise. Anything else, any tips?
Yeah, I mean, you want to exercise consistently. You also want to avoid smoking cigarettes and tobacco products. If you have a family history of heart disease or anybody with a sudden death earlier than the age of 60, you want to make sure that you see a physician earlier rather than later. Other than that, it's really seeing a physician every year and making sure that your blood pressure is good, your cholesterol is good, anything that we can help prevent. We can't prevent genes, but we can prevent a lot of other things.
Talk to me about stroke. I'm not a doctor, obviously.
Yeah.
You are.
Yeah.
So I know that there is some correlation between heart disease and stroke, but explain that.
Yeah, there is a lot of correlation because if you have blockages in the arteries of your heart, you most likely have blockages elsewhere, and a lot of times that's in the vessels that go to the head. Other conditions that belong to the heart would be arrhythmias. You can form clots within your heart that then unfortunately can go up to your head. And then there's some other associations there. So those two run pretty hand in hand.
It's pretty exciting time medically because of all the new procedures, right?
Mm-hmm.
And all the sort of minimally invasive ways to treat some heart conditions. You were just talking to me about minimally invasive valve surgery, so talk more about that.
Yeah, so there's a couple new technologies that are out there that have really made the future exciting for both physicians and patients. The first is, instead of opening someone's chest all the way, we now can approach isolated aortic valve disease or mitral valve disease or any valve in the heart for that matter through a very small incision. So we're talking about an incision about this big versus an incision what we used to do, which is that big. We provide that service at all of our hospitals in South Florida, and Florida Medical Center being one and Delray being another. But what really has me the most excited is rather than having to open someone's chest at all, we can now actually replace those heart valves via a catheter. And most often than not, we can do that through a catheter in your groin. And it hasn't really penetrated the public yet that this is an available technology, mainly because it's been mostly study related and it's been in high risk or inoperable patients, but very soon it's going to be open to medium risk patients, and then after that I would predict within 10 years it'll even be open for low risk patients. So I think that's where the world is heading. There's fascinating technologies out there for both actually even replacement and repairing a valve for that matter.
How does it work? How do you go in through the groin and end up all the way up here?
That's a great question. So you got to think that essentially all I am is a glorified plumber, right? And so we use the pipes to get there. So we go in through the groin, we take a wire and we put it inside. So if we're going to do an aortic valve, we put it inside the heart. Then we take a catheter and we go all the way up and over, and then the valve usually comes loaded onto a catheter, and we position that valve right within the normal valve leaflets, and then we expand it. You can either, there's a balloon expandable device, or there's one that we call self-expanding, which is just like a regular old stent. And you literally are just turning a knob and the valve slowly opens, and then within 5 to 10 seconds you have a brand new functioning valve.
That's amazing.
It's really impressive. It
Yeah.
is really impressive. And having worked with this technology a lot, there's most of the patients that we've done it thus far on are patients over the age of 70, 80, even over the age of 90, and The patients will generally come in and have the procedure done one day, and most of them are either going home or to a rehab facility, with most of them going home in about 2 days.
Unbelievable. And then does it last for the duration of your life? You have to come back and get a new valve? How does it work?
Yeah, we don't know the answer to that because it's still a new technology, but if we use the information that we have on the open heart side, the valves should last somewhere between 15 to 20 years. And I can tell you that looking at these valves, they're behaving fantastic. They look brilliant.
It's funny, you said earlier that you're a glorified plumber, but
Yeah.
I don't think plumbers go through as much schooling.
No, they just make more money than we do.
Wow. So you did all those years of schooling to make less money.
Well, I don't know about that. I mean, we have lots of student loans and things that
Right,
continue to hang over our head
That's
for
a
years.
good point.
Yeah.
Now, so are you really handy around the home? Can you fix the sink if it's clogged because of what you've learned now?
One of the other great advantages of my job is we're actually almost never home because we're usually at the hospital, so I can't answer that question.
That's nice to hear for the families. Well, I'm never home, which
Yeah.
is such a huge advantage in my life.
Keeps them from getting sick of you.
Yeah, no, believe me, I'm sure. I get that. So, all right, so tell me again, September 29th, how can people come visit you and what happens when they get
So
there?
again, Florida Medical Center, September 29th. The phone number is 866-498-5433, and then the website is www.fmc-campus.com.
Okay, and before we go, we have a little bit of extra time. What is the takeaway for someone watching at home that is sort of heart healthy but not really? Like, what do you want people to know about how they can protect their heart?
Be seen. Be seen by a physician every year. Go and get your annual exam.
Yeah, even if you think you're totally healthy.
Even if you think you're totally healthy.
But when you say annual exam, so you go get a physical, can't they miss stuff by just listening? In other words, how in depth, when you get a physical, should you be getting an EKG? Should you be getting an echo? What should you get?
Depends, we modify it depending on your age and your risk factors, but in general, most people who go and see a cardiologist will get a physical exam, some basic blood work, and an EKG.
So you're saying not just go get a regular physical with your GP, you're saying go see a cardiologist?
Either person, but they'll tailor it based on, I was referring to the cardiologist if you do have a known history, but if you're completely free, then anybody works, but you might ask that. The best advocate for the patient is the patient, and they can't be an advocate unless we give them the proper information. So if you're worried at all, I'd ask your physician, hey, I want an EKG too, and they'll be happy to provide that for you.
Gotcha. Dr. Bethea, good to see you.
It's great to see you, Dave.
And stay in touch.
All right.
You got it.